Hello friends, many of you must be wondering what is dental OPG X-ray and what is dental CBCT X-ray and what is it important in treatment plan of dental implant. Yes my friend, I Dr. Mayur Khanna from Precision Dental World, your full mouth implant specialist. In this video, I'm going to explain all your query related to dental OPG panoramic X-ray and dental CBCT scans. So my friends, there are basically many dental X-rays in the dentistry, but these are three most common, that is dental IOPA X-ray, dental OPG and dental CBCT. So dental IOPA and dental OPG is basically a two-dimensional X-ray, and dental CBCT is an extended version of dental OPG, but it gives at the same time third dimension, that is nothing but the width of the jawbone. So let me explain you a difference between IOPA and OPG. IOPA covers only few teeth. It's confined to just 2 or 3 teeth, which you can see on the image left to you. And dental OPG is a general X-ray. It helps us to evaluate total jawbone and all the teeth. So it can help us to see your jaw joint. It helps to see your all the teeth. It helps to see your sinuses, and it helps to see us the vital structures like nerve. Now this is basically a dental OPG X-ray of an adult whose all teeth are very well, but I will show you an X-ray of a young boy around 7 years. You just see this as all his teeth, that is all teeth are milk teeth, and below this milk teeth are the permanent teeth buds. So you can see what we just see in the mouth is totally different apart from what it is inside the jawbone. So that is why it is very important to see the jawbone with the help of a dental X-ray. So many times we get an inquiry, send us the code for so many things, send us the code for full mouth implant, send us the code for this, but we need to do a proper treatment plan for each and every case, and each and every case and each and every individual is different. So the treatment is not like some product, it is a treatment. So it has to be done with the proper protocols. That's why we recommend them to send a dental OPG X-ray. Now, for example, take this situation of this young boy around 19 years says me that I need a full mouth implant, my all teeth are compromised, everything is gone. Send me the treatment plan and the code. But we recommended him to take the dental OPG X-ray, and then what was seen was a big surprise, because his just teeth are not which is visible, but there are so many teeth which is impacted in the jawbone. So you can see and appreciate in this image that there are so many teeth which is left out in the jawbone, and it needs to be erupted. They never erupted back. That is why it is very important to see your teeth clinically, the way above image is seen, and also with the help of a dental OPG X-ray. Once the OPG X-ray is approved, then we recommend the patients to take CBCT X-rays to see the third dimension. So again, this patient, he lost his upper right hand side teeth. He recommended, I want only replacement of right hand side teeth, only those are missing. When we told him to take the dental OPG X-ray, we found that all his teeth are compromised, and he was only having a desire to replace his right hand side. So how? So if you see, there are so many severe infected teeth, many teeth were supra erupted, there was all decay below the crown, and well, you can see in this circle, a yellow circle, you can see these teeth are literally slightly mobile. So if we replace his upper right hand side with the dental implants, and this left hand side patient's teeth are loose and mobile, and eventually they fall out, patient will start chewing on the implants, and eventually if the implants are overloaded, then the bone will reject the implants, and that's what we don't want. We always want your implant should stay in your mouth for your lifetime, and that is where the treatment plan is most important. And how we do it? With the help of a dental panoramic X-rays or dental OPG X-rays. So you can see in this, even this area has a lot of decay. So if this decay is there, patient will start chewing on one side because of the pain. So we don't want that. We always want an equal function. Patient should chew from both the sides. That's very important. So what is our goal? Our goal is to treat the case as a whole, so that there is no problem to the patient in future. So similarly, let me take you to another case. Now this patient said, I want to have a fixed teeth on my right hand side, because all her right hand side teeth were missing. When we saw the X-rays, like all the teeth were almost compromised. There were few fractured teeth, there were few infected teeth, few were having a little bone around them. So we convinced her, we told her the importance, and then she decided to went ahead with a full mouth reconstruction. So that's where we did her a full mouth reconstruction. She received the teeth. Now she's extremely happy. There is no problem since last 4 years. Now, when patient gets ready for a sick dental treatment, we recommend them to go ahead with a dental CBCT X-ray. Now, what is dental CBCT X-ray? So, for example, let me show you about this case. Now, below, next to me is a dental panoramic X-ray of the same patient. Upper is a diagrammatic representation of panoramic X-ray. The X-ray looks like it has a very good bone, it's abundant bone, but if you see, there is a two possibility always. This is a panoramic X-ray always gives us length, the height, but it doesn't give you the width. So the blue line is going to be a cut, and there is a two possibility over it. Either it will have a good bone width, which you can see above, or you can have a thin bone width, which you can see next to me. So that is a X-ray, panoramic X-ray. When we took a CBCT scans, you can see above there are yellow vertical lines. That area is going to be the cut area, and below from number 45 till 41 on the left hand side and 312, 33 on the right hand side above me are the areas, are the cross-sectional areas of front area, and you can see that the bone is so thin out. In this area, if we don't take a CBCT scan to see the third dimension, this is called third dimension, also called as width of jawbone. So if we don't take a CBCT scan, there will be unnecessary, unexpected surprises when we open the jawbone, when we see the jawbone. So in that situation, it will become a bit more confusing and more tricky. So that's why, in order to avoid a confusion, we ask always our patients to get the CBCT scan, especially if it's a full mouth case, so that we can avoid all type of confusion. Well, because the bone was thin, patient received the bicortical single piece implants, also called as basal implants in the lower jaw, and upper patient received the retrievable screw retained implants. So that's the OPG of the patient after the treatment. That's the teeth which is given to the patient, and that's the final day 3 and after 6 months. This is the patient which is happy now. So that is the OPG of the patient after receiving the teeth. Well, you can also see now how the implants is being placed. Because this is a polished bicortical implants, the shaft of the implant is almost exposed, but the thread of the implant is exactly into the jawbone. Because the it is so thin, it is impossible to place any other implants in that region, and we cannot leave the patient without teeth. So what is the advantage? So the most important advantage of taking the panoramic or OPG X-rays and CBCT scans and sending it to the doctor, you can receive a treatment plan and code without coming to the center for consultation. A patient, like usually we get inquiries, lot of inquiries from all over the country and also all over the world, and for them it is not just possible to come from so far and visit for just checkup before the treatment. So in that situation, the patient sends us dental OPG X-rays and dental CBCT X-rays, and we give them a treatment plan and a code suitable for their particular situations with all possible options. It saves their time of consultation, and patient don't have to wait so much. They can directly come for the treatment and they don't have to wait, and in 3 to 5 days they can transform their life. So it also helps us to improve the accuracy in the treatment, because the patient is coming from so far, and if we have both the X-rays of like dental OPG and dental CBCT scans, it will really help us to just make a precise, accurate treatment plan. What is expected from the patient? In order to receive a treatment plan and code, they can send us again the dental OPG. It is also called as dental panoramic X-rays and dental CBCT scan. You can take a screenshot of this particular thing. So this CBCT scans need to be 1 millimeter of cross sections for maxilla and mandible. Maxilla, usually the focus must be on pterygoid bone on the both sides, and if possible both sides zygoma as well. Zygomatic bone is this bone, it is called zygomatic bone. In case of very resorbed bone, we use zygomatic bone. That's why we recommend to take a focus on zygomatic bone. The mandible, we request the CBCT center to do a marking on the mandible, especially inferior alveolar nerve, and send the scans, a soft copy of the CBCT cross-sectional images on this particular email ID, precisiondentalworld@gmail.com, drmahiknar@gmail.com. Also send us all the DICOM data for the CBCT of the patient through WeTransfer or some other links. So this particular instructions can be given to the CBCT centers, and they will help you how you will find a CBCT. Just you have to Google a CBCT center near me, and you will get a lot of CBCT centers address which is closest to you. In case of emergency, you can also contact our helpline number. They will definitely help you and they will guide you how to get the scans. So if you find this video really valuable, then do not forget to like, subscribe or share our videos. On the upper corner you can see multiple case studies of the patients who have undergone dental implant or a full mouth dental implant treatment. On the below tab you can see how you can afford a dental implant, and what is more important, cheaper dental treatment or a cost-effective dental implant treatment is important. So do not forget to watch that video. So stay connected with us for our next video. Till then, thank you. Jai Hind, Jai Bharat.